Hello, good people. So we are back again. This is the Stay Can Show. Stay Can stands for Standing Together Against Child Abuse and Neglect. We are back again to talk about another aspect of mental health. And this evening, well, depend on where you are, which part of the globe you are. And in the UK and in Ghana, it's in the evening. So we are going to talk about depression. And as we normally do, before we go right into the subject, our honorable panel members will be introducing themselves, especially for the benefit of those who are joining us for the first time. So without much ado, I will start with Dr. Ajele, please.
Thank you. Good evening, everyone. My name is Dr. Olaiwola Ajile. I'm a consultant psychiatrist, forensic physician in the United Kingdom. I work with the National Health Service, and I've been practicing in the field of specialized mental health services in the last 17 years. Part of my work involves working with people with acute, mental health problems of various types, and also with the police, helping them in the interface between law and the medical aspect of law and forensic. And this is what I do on a day-to-day basis. I'm pleased to be here. Thank you, and welcome everyone.
Thank you, Doctor. We would move on to William, please.
Good evening, viewers and listeners. It's great to be back again, following our discussion, a useful discussion last week. It's such a lovely discussion. And I could tell about the passion that actually came out from people. So yeah, great to be back again on board. My name is William Ejapon. I'm an approved mental health professional for the past 12 years. I work mainly as the Deprivation of Liberty Safeguards Manager for Birmingham City Council. But part of what I do is also the mental health side. So I tend to come across a lot of cases where there's been several mental health issues of various degrees. So you could talk about depression, you could talk about people with all forms of psychosis and psychotic symptoms, schizophrenia, and the rest. So yeah, it's an area that I'm really passionate about, and I hope these discussions today will be more interactive. So yeah, great to be back again, Elsie, and great to see you all.
Thank you, William. We would move on to our final panelist and Madam Veronica.
Yeah, good evening, viewers. My name is Veronica Tando. I'm a forensic nurse by profession. I've been a mental health nurse for the past 30 years, and I've taken semi-retirement, so I work part-time now. But in terms of my experience with mental health nursing, it goes beyond the vast types of mental illness, and so I've dealt with people with depression, and I've actually nursed a lot of people with depression. So I'm here just to share my experience as much as I can to help each and every one of us. Thank you, and enjoy the show.
Wow, that's fab. So viewers, you can tell that, we've got the experts over here. They've got, the knowledge, they've got the experience, they are the experts. So please, by all means, ask your questions. And like William said, we want this to be as interactive as possible. So we would zoom right in. We've got, Mr. Paul Boateng saying that welcome our panelists. So thank you for welcoming us. We will zoom right into the conversation. So we will go on. So we are talking about depression. Depression. And obviously everybody wants to know what depression is all about. And Doctor, would you say that, depression, is it a mental illness?
Yes.
Just for us, okay.
Indeed, depression is a serious mental health disorder.
Okay.
And it is one that is very, very common.
Yeah.
Very common in every society. And it's one that's also often missed by a lot of people. Hence the need for us to raise the awareness and, analyze and evaluate what depression is and inform our people adequately of what the problem is and how we can go about getting help when we need it. Yes, it is a serious mental health disorder. It is recognized under the International Classification of Disease, of mental illnesses and mental disorder. And it is one that can be deadly also, if not adequately looked after. People have been known to die of depression, either directly or indirectly by taking their own lives.
Yeah.
And we're going to be talking into greater details about, the complex cluster of symptoms around depression, I'm sure, as the time goes on.
Wow, thank you for that. So yes, as we're going right in, we would want to start a discussion with what depression is all about. So I mean, doctor, if we could come back to you to start us off, looking at what depression is all about. And I think you have, you've made a start anyway in your earlier, in your earlier response. So yeah, would want to hear further from you.
Okay. Yes, I think depression is a disease of the mind, and it is one that is characterized by persistent low mood. Normally, everybody have fluctuation of their mood from day to day, depending on what's going on. You may be up, 1 minute because something excites you, or you may just feel down, because something, upsetting happens. So there are, ways in which mood can fluctuate from time to time. But in a situation where you have persistent low mood, feeling very low in your mood for up to 2 weeks or more, and without any reason, it could be without any reason at all. It may be secondary to some other issues, maybe some bad news, some, bereavement, some losses, some trauma, but it carries on longer than 2 weeks, then it's best to suspect depression. So that's the first symptom, and commonly when people are in that state of mood, there are other symptoms called biological symptoms that are associated with it. And people begin to lose their sleep, okay? People begin to have difficulty with their sleep pattern, either in form of reduction of sleep duration, or either they have fluctuation in the sleep pattern, whereby they're unable to sleep at night, or some cases can even begin to sleep excessively, so there is disruption in sleep. But commonly we have insomnia, inability to sleep or initiate sleep associated with it. And this is because people are often awake and ruminating. And oftentimes that rumination is negative rumination. And that can progress into more severe, symptoms of suicidal ideations if it's not identified. Other type of biological symptoms that is associated with depression is also loss of appetite. People just go off food, and people can begin to lose weight as a result of that. They just nothing appeals to them. They lose interest in pleasurable activities, things that they've always enjoyed. They just go off it, and we call that anhedonia. People just withdraw from their pleasurable activity and nothing moves them. And people can also have difficulty with their sexual, libido. So they just have reduction in sexual appetite, and this can be quite common, particularly in men. When they are depressed. So it could be the heralding symptoms, of depression. Now, as time goes on, if this is not identified quite quickly, this can progress to social withdrawal. People just withdraw from everyone. So when you have someone in your society or your community or a place of work or church or wherever, area we find ourselves, who suddenly become withdrawn, and they often, from activities such as social, occupational, then we can begin to suspect whether they have depression or not, and we need to, check them. So people have social withdrawal, and then people also develop difficulty with initiating conversation very well with people. So they become very mute, they become very internalized in their cognition. And that can lead to negative cognition. Everything they see is negative. They begin to see no value in themselves. So they have low self-esteem, low self-appraisal. They cannot see any appreciation in whatever achievement is around them. For example, you know, a grandmother who's been quite loving might just withdraw from the grandchildren, you know, or withdraw from the family. They don't enjoy the company of those people anymore. Other symptoms obviously will lead to people having, you know, thoughts of suicide as well. People begin to feel hopeless about life. People begin to have ideas of worthlessness. And when they begin to ruminate about wanting to die. So depression can progress in that direction, and people have been known to attempt to kill themselves or try to harm themselves in various ways, by either taking overdoses or using poisoning, or try to. I've known people who have because of depression driven their car, you know, in high speed just to, you know, crash it, to kill themselves. People have been known, particularly in recent times in Nigeria, to just suddenly go and jump into the, you know, to the river, you know, without any way of saving them. They don't know how to swim. So that natural drive for life is for one to want to live. You know, if you are dropped into the water and you're drowning, you want to survive. You try and make effort. But in depression, you know, the drive for life becomes negative. It goes into reverse. So people begin to ruminate about death or making investigations, you know, on how to kill themselves and how to achieve the result they want, because they just cannot see anything positive about their life anymore. So that is depression. Now, it can get so complicated to the point where people now develop what can be termed psychotic symptoms, okay? And this is commonly associated with the severe end of depression. I have to say at this point that depression exists on a spectrum of mild to medium, mild, moderate, and severe depression. And that is the way it is categorized in the classification of disease of mental disorder. Now, when people get to the point where the depression is so severe, they have almost all the symptoms I've talked about, okay, in severe form of it. And they can develop delusional ideas. Now, the delusional ideas consist of negative delusions. You know, they're called, you know, ego-syntonic delusions, in the sense that it is mood congruent, sorry to say. So it's a mood congruent delusions. Because of their negative frame of mind, everything they see is negative. They are nihilistic in their ideas. They feel, you know, like, you know, they have delusion of poverty. Even in the midst of plenty, they don't see that they have anything at all. Some people might begin to feel like their part of their body is rotting. You know, their brain is not there. They don't have any brain in their head. And when they feel like this, you know, they feel like, what's the point of living? And some of them may think that their guts, their intestine is not there. So that justifies the reason to continue to avoid food. And obviously that can lead to significant physical deterioration. And people have been known to die of starvation. That's what I meant by people can die directly or indirectly from depression. Okay, so people have been known to starve themselves because they believe they don't have intestine, when they have delusional nihilism from you know, depression, and then they don't eat for a very, very long time, and eventually they will pass away. So that is depression. So they do have mood congruence. It's always negative mood, negative, you know, ideations. It's not common that you see people feeling elated or feel that they won a lottery or feel that they, you know, they have excessive power or wants unusual power with depression. No, it occurs with a different type of mood problem. But with depression, it's always the negative one. So those are the common symptoms associated with depression. And, you know, and as I said earlier, we need to make a distinction between depression and sadness. You know, sadness is an emotion. People can feel sad from time to time. And sadness is transient. So we should not we should not sort of mistake or confuse sadness and depression. When people are bereaved, they will be sad for some time. And usually that kind of emotion is short-lived. But depression is persistent and it needs intervention. If it's not treated, it gets worse. But with sadness, obviously, you feel sad for a temporary period of time. And obviously, that tends to get better with time once you have, some reflection on what has gone wrong. But with depression, it is not like that. It is always a spiral, downward trend. And people can get very worse to the point of killing themselves. So that's generally, in a nutshell, what depression symptoms are consisted of.
Wow, thank you, doctor. Can I just ask that, would you say, does it affect men and women differently, or is it the same?
Well, I think the prevalence of depression is equal, between the sex. Both male and female can be affected equally. Although we have in practice seen that a lot of men don't often come forward, to come and complain about depression. I think a lot of time women come. So artificially, it looks like it's a disease that affects women more. But it's of equal prevalence between the gender. And it can affect children as well. So there is childhood depression. There is old age depression. So our older people also commonly can suffer from depression. And the quality of symptoms is similar, across different age group. So that's basically how it is.
Wow, thank you for that. That is really detailed.
I think there's this thing about men generally not going to doctors and reporting issues to doctors, especially their health. And you're right. Research has even shown that, we don't even need research to show us this. Me being a man, sometimes we keep things to ourselves and without having to go to the doctor. We self-medicate, we find solutions for ourselves, which women are likely to go to the doctor. Women are likely to talk about their personal issues, talk about their health, which is most important. But there's this thing about men that we need to break away from that, which is not helpful. Yeah,
that's right. And especially when it comes to our culture as well, our men don't. They don't want to talk about things because they might feel that when they talk about I'm feeling sad or I'm feeling as if life is not worth it, then they're weak. So then they don't talk about it. And even during this shutdown with this pandemic, especially few young men that I have spoken to, because I speak to a lot of young people, a lot of young men that I've spoken to, if a lot of them explain where they've been, even during the shutdown, and I tell to them, look, it sounds as if at that time you guys were depressed. But then they say, oh, no, auntie, no, it's not. And I said, well, but what you're describing, that's what it is. But again, our culture doesn't allow men to come out and talk about these things because it makes them, they're weak. And I think for me, that is the danger, because if they don't come out early, then it makes it difficult for it to be treated.
Absolutely.
If I could just buttress that with a practical example, because I have got a young boy who came from Nigeria to study here, highly achieving from a well-to-do family. Obviously, he got depressed in the course of doing his degree. He didn't want to tell his family, but his education was suffering. He couldn't cope with the demand of the education anymore. He's postgraduate, and the parents have paid a lot of money. Before they would identify that he got depression, it was too late. He had lost a lot of time, and he couldn't just continue with the course anymore. Before they called me from Nigeria to say, could I help them to actually manage this way? The damage was already done. So it can actually take away a lot of things from people. So our men, who most of the time in Africa are breadwinners, with our women and children needs them to go and work. And if depression can take away the ability to be productive occupationally, then it's a serious problem. So therefore, when our wives or our women notice that their husband become withdrawn from the family, then they should try and encourage them to seek help quickly, because as we're going to talk about, it is a treatable condition. It is reversible condition. So before it damages the family, damages the business, damages whatever we do in our day-to-day life activities, you know, we need to get help for it. So there's nothing about weakness in it, you know. You know, it's just being very, very realistic and very proactive about one's health. As much as we have with our physical health, you know, our mental health is also of essence, you know, in what we do, and it can actually affect everything we do if we're not, you know, adequately looking after them.
And just also for us to bear in mind that it doesn't, I always tend to say this, it doesn't discriminate. You can find, it can affect the rich, it can affect the poor, it can find the working class, it can, even the upper class, or even those in the higher society, higher achievers within our society can even affect them. So we all need to bear that in mind.
And I think this links in well with Abdul Wahab's question. Abdul Wahab Abubakar is saying that I just joined and I may miss earlier lectures. I want to ask if the symptoms of depression vary based on race, family, and country you come from. So, William, do you want to, you know, I know you have, you know, you did points on this a bit more, but then can you talk about this a bit more, just for the benefit of Abdul and other people who are watching here?
I like research, but I always like to approach things from what I've actually observed in practice. I think that's more evidential than what somebody has done, which I haven't been seeing the information they have used. So from my own knowledge and from my own experience, I've come across rich people who have been diagnosed with depression. I've also come across the very poor people who have also suffered some form of depression in one way or the other. So as I said earlier, it affects everybody. It affects every race. It affects every culture. It affects every family. It affects every country, every creed, every background, every religion. Yes, no matter. It affects the young. It affects the old. I have seen as young as even 10-year-old with depression. Yes. So, and I've seen a 105-year-old woman with depression. So yes, it tells you the wider spectrum that it can affect. So it doesn't discriminate at all, unfortunately. We all can be susceptible to depression. And it's important that we all look after ourselves well. We take good care of our physical health, we take good care of our mental health, and then support each other within our community. That's what it's about.
Wow, thank you, William. Yes, and I think that, you know, just as you said, I mean, it does not discriminate. Everybody, you know, can get it in terms of, you know, your race, your background, whether you are rich or poor, whether you are a man, a female, or a male. I think that what is important is what Dr. highlighted, the support you get. You know, people who have the condition are people who are suffering from depression need support, but, you know, from people who are around them, family members, you know, spouses and all that. They need practical and emotional support. What they don't need is the stigma, you know, we tend to attach to the depression, because that does more damage. That will do more damage than good. And again, we have highlighted, I mean, the fact that Madam Veronica did talk about the you know, the role of male in society, and how, you know, a male who is, or you know, a man with a condition may be seen to be, you know, or who will come out, you know, to say that he's got a condition, may be seen to be a weak man, and therefore society, I mean, expects a man to be strong and strong. And I mean, to be fair, that even prevents a number of men even from I mean, going to the hospital for even, like, you know, when they've got headache, when they have, because when you go to the I mean, one guy sometimes told me that I haven't been to the doctor for, like, you know, 16 years, and he was very, obviously that is good, but the point is that, you know, the society, or how we see men, you know, kind of prevents men from seeking support,
Yes.
projecting themselves to be, because projecting themselves to be weak in societies you need to be strong, and then and in the same vein, when you go to funeral grounds, men are not supposed to cry, men are supposed to be strong, it's only the women who cry because the women are weak. No matter who has passed away, no matter how the person is close to you, whether it's a best friend, your dad, your mom, you have to be strong. You can't show your emotions, So these things are all part of, the challenges affecting women in our society. So yet we can't discriminate. And yet, in terms of William, can I come back to you? In terms of your own practice, and your experiences of, working with or supporting, patients or clients or families, parents with a condition, can you give us some of your experiences in terms of, your experiences as a mental health, practitioner?
Yes. Before I come to that, I just want to say that before COVID came in, 1 in 10 people were showing, there was a research done, and 1 in 10 people were showing symptoms of depressive disorder. Now, since COVID came in about a month or two ago, BBC done a research, and they found that 1 in 5 people are now showing depressive symptoms. Wow. So it tells you how much COVID has done huge damage to us. Number one, which involved the lockdown. We were all locked down at some point, and as we even are talking at the moment, we haven't fully recovered yet. People having had good holidays this year, people having had good break from work, and there's not much excitement out there, which has all contributed to this. Now, even when you go to, let's say, we got somewhere called place of safety. Place of safety is where people have got mental illness and then are not able to cope in the community, or maybe found outside their own homes and then being taken by the police. So they may show some form of mental disorder, and then they'll be taken by the police to mental health. It's like a secluded area for them to be seen by a doctor and then a mental health professional. So they call that place of safety. And each local authority have their own place of safety. Now, if you check on the number of people who have been taken to these places under Section 136 of the Mental Health Act, now that number has doubled as I speak, as compared to previously when there was COVID. Just to give you an idea in terms of what's happening at the moment. If you were to check with Samaritans, for example, there's been so many phone calls to Samaritan about people who are seeking support, which is a great thing. And I don't want people to sit down at home without seeking support. But all I'm trying to say is that the number of people experiencing some form of mental ill health has doubled, if not more than doubled, as we speak. So in terms of my own experience, when it comes to depression, yes, in terms of my own experience when it comes to depression, now you and I, we got our own activities of daily living, don't we? Yeah, we wake up in the morning. Everybody's got their own set of routine. So I may probably wake up. I'm an early riser anyway, so I tend to wake up around 6, latest 5:30. I get up. I have my wash. I have my. I'm not a tea person anyway, so I eat my breakfast and then set off and do my work. Yeah, so that's my routine. Now, if for some people with depression, what I've noticed is that this routine, they lose this sort of routine in their time, in their life. Some people I've seen them, they decide to stay in bed all day. They lose that enthusiasm, they lose that passion, that energy is gone. They become so flat. The mood is so low, no aspiration at all. They don't look up to anything at all for the whole day. Yeah, they don't even want to get up to have their own personal care. They don't even want to get up to have breakfast. They don't even want to get up to do anything at all. You know, they don't even want to get up and go to work. They become so flat. So when you tend to see these things in people, then it tells you, there's something not quite right here. Even simple things like some people tend to, part of their routine is that they have to walk a dog. They'll get up in the morning or probably in the late evening. They'll do about a mile walk with a dog. Now, people that I've seen in practice, they lose all these routines. Life is worthless for them. They'll become what I call fog thinking. The mindset becomes so foggy. They can't even concentrate. They don't look up to anything at all. It affects their emotions, yes, and their relationships. Issues with their partners, issues with their family members. Family members can't talk to them. They become so irritable, or they just lose interest in conversation. So it's all sorts, Elsie. So what I tend to see is that when you see symptoms which is not of the usual person's presentation, then it tells you there's something not quite right here. Okay. Naturally, some people are extrovert. They like to talk. They like to do, very outgoing people. So when you see them very withdrawn, when you see them being themselves and not want to engage in those other conversations with people, then it tells you it's not of their usual selves. Yeah. And these are the sort of things you tend to, simple things like that, you tend to see in practice of people's presentation, which may be attributable to depression.
Yeah, and in terms of my line of work, supporting children, the cases I have, come across are situations whereby parents are diagnosed with depression. Well, sometimes, when we have our meetings, like, child in need meetings, core group meetings, or our conferences or whatever, parents may talk about, talk about symptoms, for instance, saying that, like, as we have just, as we did highlight over here, they'll be talking about, I don't really like to wake up, I feel really down and all that. And then a professional may suggest that, and why don't you go and see your doctor? Sometimes the parents may, at the next meeting, we would want feedback, and then he or she would tell us that, okay, I've been to see my doctor in terms of the actions that were put down. I've been to see my doctor, and the doctor is saying that, I don't have depression, or I have depression, but then I don't have to be on medication. So these are the cases I have come across. And within the COVID period, well, I used to have a mom who was on medication, but then had gone on the medication for so many months because she said that the doctor couldn't get the medication. I'm not sure how true that is, but then she had gone on she wasn't taking her medication. But then in terms of us, we are trying to look at the impact that is having on the parents on your parenting ability. Because if it is impacting on your ability to parent, ability to meet the care needs of your child, and then where there is neglect of your child, not meeting, basic needs of your child, and there is neglect, where there is emotional abuse, where you are like hitting your child because you are stressed yourself and all that, then, so we would then be looking at the impact of your own mental health on your parenting. And then obviously we would complete an assessment to see that whether, you need an additional support, or whether the child is safe in your care, or whether we should look at other support network in terms of your family members and friends to come in and support with parenting, and all that. So that is the situations I have come across. And
we tend to see that also in adult social care, where some of the adults are actually carers, so they care for maybe their disabled children, or they care for their elderly parents or elderly relatives. And maybe due to stress, due to the impact of their caring responsibility, it causes them stress. Stress then leads to distress. Distress then leads to depression. And if not controlled, they tend to immobilize them, and affects them quite greatly to continue with their caring responsibilities. So you are right. Yes, these are common things that are observed in practice.
And then I also come across situations whereby there is domestic abuse, And then within that, a parent then is diagnosed, as kind of starts to have mental health difficulties. And then the parent may be diagnosed with, depression. So yes, so I like, was working with this very like, severe domestic abuse case where we didn't really know who the perpetrator is and who the victim was, because they are as bad as each other,
Yeah.
So sometimes it's really tricky. You can't really know who the victim is, because mom is very loud, dad is very loud, and you just and the relationship is just like that. Yeah, but then later on, mom was spending all her time. Mom, stopped working. She was spending all her time, in bed. She wasn't eating, and so she was severely underweight.
Wow.
She wouldn't come down and interact with the family, because she said that, well, I don't want to have any issues with dad. I just want to keep to myself. And then again, she wouldn't engage with social care. She wouldn't engage with school. She wouldn't engage with the police. She wouldn't attend any meetings at all.
Wow.
And then she did say that dad was saying all the negative things about her, even though they are not true, and that was impacting on her self-esteem, and that her self-esteem had gone to the bottom, her confidence had gone to the bottom, and now she doesn't even want to go out for a walk, because I was suggesting to her that, why don't you just go out for a walk and have fresh air? That would help with your well-being. She was saying that, I don't even want to go out for a walk, because I just feel that the neighbors are talking about me, and they think I'm not a good person because of all the things my husband has been saying to them. I don't want to go to my children's school because I feel embarrassed. I feel that nobody really respects me, and because of all the things they've heard about me. And so I prefer to just stay in bed. And and I was just trying to work out whether she's got families and friends around who I could contact for us to like kind of put a safety plan in place. Because at the end of the day, you've still got children in the house who are under your care. And if you are not able to, if you are going through this yourself as an adult, and you are going through these difficulties, this stress and these challenges as an adult, with your own well-being, will you be able to care for your children? So I was trying to her support network, and she had told me that she didn't have friends, and because her partner had managed to say all the negative things to all her friends, and because of that, they are all isolating from her. And she didn't have any family in this country, and she came from a different, she didn't come from here, so she didn't have friends in this country, and so she felt she was kind of really isolated. Then I was just trying to look at how best to help her. I mean, yeah. So these are some of the cases I do come to: domestic violence, depression, and in a number of the cases I have come across. In terms of domestic violence, there are some elements of mental health, and then in a number of these cases also, one or both parents are diagnosed with depression. But then I would say that in most cases, I would say the victims can't go along those lines to have depression. And I know we've touched on domestic violence and mental health before in the past, and how
Let me just say a bit more on, because we obviously give different scenarios and examples in our practice of how depression can express itself in various forms. But from clinical diagnostic perspective, it's important to know different types of depression also. Let's start from when a woman is pregnant. Okay, people can have prenatal depression, and that can arise due to a number of things. Changes in their hormonal systems. The expectation about the delivery, or lack of support during pregnancy, or if they're in lack of support and a supportive relationship. People can develop depression from there. But the commonest one, which is quite critical and crucial, is postnatal depression, the depression that people develop after they've had babies, which can sadly sometimes be serious to the point that people with severe postnatal depression can kill their baby.
Yeah.
And that is the risk with that. When people have a child and for some reason they are unable to, bond with this child, they begin to have negative ideas about the survival of this child, and they are unable to, engage with the activities that's required as a new mother, or express the joy or appreciate the joy associated with that delivery. Or sometimes they might think the baby has got some negative, sort of attributes or ill health of some sort, and they are overwhelmed with anxiety. And this is quite common within the first 6 months or to 1 year of pregnancy. So any depression that occurs in a nursing mother within 1 year of giving birth is a postnatal depression. And they are looked after by a specialized service in the healthcare called perinatal services. And sometimes it can be so severe that they would need to go into hospital in a mother and baby unit, whereby the baby and the mother will be present under strict supervision, because some of these people have been known to kill their children. And we have seen, very cases that goes to court of infanticide, because sometimes it may be, on the ground of mental health disorder, these mothers, will be absorbed of this problem, because obviously they have severe postnatal depression. So that could be the consequences. And all the symptoms we've been talking about is quite common in the postnatal depression. Withdrawal from the child, which is the focus, at that time, and not being able to enjoy or the company or the bonding experience or breastfeed. And of course, some mothers have been known to feel they're unworthy of being a mother, and they kill themselves, leaving the child on their own. Okay, so that's postnatal depression. Is a very common type of depression. And then we have depression in in general adults, which can be reactive depression due to any form of stress. Some of the things we've been talking about. People who have been exposed to any trauma, domestic abuse being one of them, sexual abuse being one of them, economic loss being one of them, separation, immigration issue, catastrophic loss of bereavement. And this can come under the purview of reactive depression, and if not treated, can easily now lead to, clinical depression on its own. Now, when people are diagnosed with major serious physical health problem like cancer in hospital, they have no previous mental health issue, but they are given a life-threatening diagnosis of cancer or brain tumor, dementia, and some serious form of degenerative disease like multiple sclerosis and things like that. People often develop depression, serious depression as a result of that, while in the general hospital, either waiting for surgery, for treatment, for radiotherapy or chemotherapy, and they will need the attention of psychiatrists in the general hospitals. And often the specialized field of liaison psychiatrists will be required to go and see them and assess them and treat them. Also, depression can express itself after stroke. People develop post-stroke depression, okay, because of the impact on the brain and perhaps the disability that the stroke has left them with. So people can develop post-stroke depression. So anybody who's recovering from serious cardiovascular accident, heart attack, stroke, we need to watch them because they often develop depression. We need to watch them. Now, people who have suffered chronic mental health disorders like schizophrenia for a long time can develop post-schizophrenic depression, and oftentimes people think that they've recovered from schizophrenia because they don't usually have the positive symptoms associated with schizophrenia, the hallucinations, the thought disorders and the delusions, paranoia. They don't have it. They're just apathetic. They're just withdrawn. They can't do anything. They have evolution. They cannot even dress themselves. they have no ability to organize their thought. So people, who are recovering from, schizophrenia, or whose schizophrenia has not been properly managed or treated, can develop post-schizophrenic depression.
Yeah.
Also, depression can be diagnosed in terms of types as bipolar depression. I know we're quite commonly, informed about bipolar disorder, but we often think about the hypomania and the manic, episodes. But oftentimes, people develop the depressive episodes, and that itself is quite serious because people often are driven to suicide. A majority of people with bipolar depression can easily commit suicide because the intensity of depression for bipolar depression is severe, and people tend to develop suicidal ideation. So there is bipolar depression. So, and other types, I think we need to understand that most of the time, depression doesn't exist on its own. They exist in comorbidity with other type of condition, mental health disorders like anxiety.
Yeah.
And it could be, a cause as well. Anxiety can easily lead to depression. In some people, particularly severe anxiety. Well, most of the time, when people have depression, they could present initially with anxiety, social anxiety, for example, agoraphobia, for example, OCD symptoms, and of course the limitation that places on them can, sort of coexist with depression. And people obviously, would need to have that particular situation looked after. And then a lot of people, and I have seen quite a few cases recently, people who have clinical depression but have not been able to present themselves, usually men, for assessment. They begin to drink. They develop disease of adaptation using drugs and alcohol and things like that. Class A drugs, cannabis, alcohol to mask their symptoms. They want to treat themselves with it. They think, they will just want to numb themselves of the feeling. And recently, I just discharged a man who obviously developed depression following prolonged marital issue and domestic issue. He started drinking so bad, and then he lost inhibition and decided to go to the bush somewhere to hang himself. And we had to call the police to find him because the wife raised the alarm. And they found him, trying to hang himself. I think luckily the rope snapped. I mean, he could have been successful, and all the time he said that he was going to work. After work, he would just go with his friends to the pub. He was never an alcoholic before, but obviously he was drinking heavily, and that he lost control. And then, of course, that gave him the confidence and the courage to be able to now decide that he would just end his life because he couldn't sort of face it. But luckily, that intervention helped him. They brought him to our attention. We were able to treat him, and now we discharged him, and he's back to his family. So that brings us to the fact that, a lot of people try to mask depression with different, use of abusive substances. And if we see somebody who's drinking a lot or using substance, we need to check why they're doing that. It may well be that they have underlying depression. They're trying to self-manage or self-medicate. But that is often a maladaptive way of treating depression.
That's right.
They need to have treatment for their depression and perhaps for the dependency on whatever substances they have. So I just thought I should sort of elaborate on that. Move on.
Okay, and I think that is very useful because depression is not just depression. There are different types, elements within that. So it's very good. And then, like you said, the postnatal depression is a very serious one. I mean, in the case of the postnatal depression, it's my view that because if this mom newly, who is just giving birth, she wouldn't know she's got depression, will she?
She wouldn't know, but she wouldn't know.
Some may know, some may not. Yeah.
Yeah, she wouldn't know, but then she would know that all is not well with her. She's not feeling the way that she normally feels. And when the doctor was saying, I remember a colleague of mine that I worked with some few years back in London. She had that postnatal depression so bad that she wouldn't even hold her baby. She was so scared to hold a baby in her hand. But then obviously being a mental health nurse, her husband was a mental health nurse as well. So they knew exactly that all wasn't well. And then straight away, she had to go in for this treatment to the mother and baby unit. Obviously, then she became well and she came back to work. But then I've had instances where obviously the mothers didn't know that they had postnatal depression, like you're saying. And then some of them might even have it from first baby. They will have the episode, and then some of them, the family members will just say that, oh, she just keeps crying. She's crying for no reason. She wakes up and she's just crying. She's not herself, and she's not getting up like a mother should do when you have a baby and all that. And this lady had it with her 4 children. It wasn't picked up from the first one. It wasn't picked up from the second one, third one, and fourth one. The fourth one went straight into a full-blown psychosis because it wasn't picked up from the beginning for it to be treated. So yes, it does happen. And what we're saying and what we're advocating is the fact that when we are with our loved ones, we know how they are. So when we know that when there's something different about them, we should raise the alarm. Sometimes we play down, or then sometimes we keep asking them, oh, snap out of it, or this thing will just stop. You will get back on your feet. But if you see that it's consistent and it's longer than doctor has said, over 2 weeks, 3 weeks, a month, and your wife is still crying, even though she's had a baby, and having a baby is a joyful thing, even though hormones in your system go all over the place. But if it's taking longer and she's still crying and she's still miserable, that should ring alarm bells, and that should make you want to go and ask for help. In terms of, so that because the earlier that she gets the help, the quicker she can be treated. But majority of the time, we just overlook it, or we just play it down, and then we don't do anything about that. And I think even talking about postnatal depression, my passion right now is with our young ones, our young adults, young men and young women. Even when it comes too close to home, even our own children. Majority of the time, we are in the house with our children, we don't know them. And I think I'm advocating out there to parents, please, no matter how hard we're working, let's be our children's friends to the extent that we can pick up things. Our gut instincts will tell us all is not well. Let's speak. Let's have that open conversation with our children that they can tell us everything and anything. Because majority is only after I came out from the ward. I haven't come out from the ward completely, but now I'm doing a lot of my work outside on a one-to-one, and it's just talking. And the more you talk, the more you realize that a lot of young people are going through that the parents that they live in under their roof don't even know what is happening. Because some of them will say that, oh, when I talk to mom or dad, they don't believe me, number one, or they don't take me seriously. So they are in there in their room, and they are seeing all these sorts, and there are so many things out there, especially when those who are feeling so low to the point that they feel that life is not worth living anymore. I'm sure we've heard instances when children have killed themselves in their room, and the parents will go in the room and they will see on their laptop or on their iPad to just show that a quick way of committing suicide. There's so many information out there. So I'm pleading with us parents that let's be our children. Let's, as much as we can get into their business, let's get into their business, because that is only when we can find out what is happening and they can talk to us. And when they are talking to us, as much as we are African parents, and I keep pleading with our parents all the time, let's have a listening ear. Because we don't have the answers all the time. Majority of the time, they don't want to talk to us because we don't listen. They don't want to talk to us because most of the time we think that we have all the answers. Tell them to do this and tell them snap out of that. Oh, you can do this, and your colleagues are doing this, and this person is doing that. No, your child is an individual child. And for that sake, it's your responsibility as a parent to be able to find out what is happening. If you know that all is not well with your child, find out. Ask what is happening. They might be struggling at school. They might be having issues at school. They might be bullied at school that we don't even know because we're too busy working. A lot of them become depressed at very early age in school because maybe they can't cope. And I'm a Christian, but I talk to our Christian friends out there. I'm begging us that when it comes to that, we can't just tell our children, let's go and pray. Let's find out exactly what is happening first. Let's eliminate everything. I'm not saying that prayer is good. I am a praying person and I pray. But at the same time, you have to look at the practical things and see and deal with the practical things whilst you're still praying. You can't just leave the practical things out and then just pray.
Sure.
That is no wisdom.
Yeah.
That is not wisdom. You need to be able to get into, we need to find out if my child is struggling at school with maths. I remember a friend of mine, a child was telling me, Auntie, when I speak to my mom about things that I'm struggling about, all she can say is that, let's pray, God will give you wisdom. And the child is struggling with maths and English, and all the child might need probably is an extra class that she needs to be enrolled to, or an extra teacher to come home and find out what the issue is, find out what the struggling is. Majority of our children are not talking to us. Majority, most of them, when you talk to them, they will tell you, Auntie, I'll be down so low in that deep hole so much that sometimes I don't even know how to get out. The first question I ask, have you spoken to your parents about it? Oh, they're not going to listen. They're not going to believe me. So please, listeners out there, let's get into our children's business, honestly, because a lot of them will develop depression at a very early age that we don't pick up. And if we don't pick it up early to have to deal with it, it might be too late.
It might be too late. Yeah, we need to be
It might be too late. I think the last thing too that I will add on it again, people who are going through their menopause have depression. They do. I've got friends who struggle with it so much that they're thinking that I'm losing my mind. Please, because the symptoms that you get with the menopause as you go along, some of them are so frightening. So please, when we are at that age and we're going through that and we feel that no, my brain is not like the brain that it used to be anymore, let's check. Let's do our physical check. Let's eliminate everything. Some of them you might even see that it's just menopause symptoms. And if you have to go on your HRT, do something. Don't just sit down and say that, oh, okay, fair enough. This is part of growing up. Some people can cope with it. Some people can decide to go the natural way and they can manage. Others cannot manage. People go to the point of losing their mind. People go to the point of becoming suicidal. I had a friend's mom who the friend was telling me that the mother, they nearly checked her into a mental health hospital because they thought mother was going crazy. But when they did, the GP told her to do a full physical menopause test on this lady, and it came out that it was menopause, and she was treated for it. So please, let's talk. I advocate for us to talk a lot. I advocate for us, and that now that we're raising awareness, so that people who are living with people in their home, we know how our husbands are, we know how our children are, we know how we are in the house. If you pick up an instinct that all is not well, get into that business and find out. Get into that business. Don't leave it. Don't leave it, because I've come around so many instances where things have been left unattended to. Children might have had traumatic upbringing. Some children might have gone through children might have gone through abuses that we don't know of. I've had instances when somebody came from home, from Nigeria to live with a family member here. That child had a very traumatic upbringing that the father just left the house and never came back. Father died. And never all the children got to know that father had died. This child came into this country and lived for so many years, and all everybody could see was that he was a very quiet person who doesn't talk, very quiet person who doesn't talk. Nothing was picked up at all. Nothing was spoken about. As I speak now, right now, that child is got a full-blown psychosis that is being treated right now, and it's so painful, because if it was picked up to say that he had gone through a traumatic time, and that has to be dealt with, we can't just brush things aside. If painful things happen to us, let's talk about it and let's deal with it. Painful things happen to us. We can't say that the way we were brought up, we were taught that nobody listened to our feelings and all that. But we develop a form of coping with it. Our children can't. Our children are not able to deal with what we were able to deal with. And even those of us who say that we were able to deal with them, some of us even show signs and symptoms when it arises. When you get too painful, it comes out. So it never goes away if it's not dealt with. It will never go away. And so our children let's find out exactly, are you okay? Are you okay? Are you fine? How is school? Let's find out exactly. Don't just leave them and just work. We can't afford to be making the money and leaving our children to be suffering emotionally. We can't.
Absolutely. Just want to add something quickly to that. I'm glad you talked about children and mental health, because that's sort of thing I had in mind, and I'm so passionate about. Now, these are pertinent to our community, more so than other communities. I've come across that, and it's important that we pay attention to this and do due respect to that. Now, number one thing I've also, in addition to the comprehensive discussions that you brought about, Dr. Ajile and Madam Veronica, the other thing I've also observed is the too much pressure we place on our kids' achievements.
Yes.
Now, I cannot tell you, but these are real things I've seen in practice. 3 young kids committed suicide in this country. One is of Asian ethnicity, the 2 are African. Now, these kids, we're not saying kids should not aspire to achieve whatever God has given them to achieve. Yeah, that's not we're not fostering laziness here. No, we all look for hardworking people in our society. That's the sort of thing we want our kids to aspire and become. We want them to be great achievers in our society and want them to contribute positively to our society. But the adverse side of it is that we tend to put so much pressure on them, more than necessary. Now, everybody is created according to their own capability. I've got the sort of achievement I can go up to. If you give me an aeroplane to fly, I cannot be a pilot. No, I cannot be a doctor like Dr. Ajile. No, we all created differently. We all created with different talents. And it's, as a matter of fact, not everybody is an A star. Not everybody is a B star. Yes, some are footballers, some are doctors, some are lawyers. But we've got this thing about us. I don't know that all of us want to be doctors. All of us. Oh yeah. When
engineers.
Engineers. When I create you, my son. No, I want you to be an engineer. I want you to be a doctor. I want you to be a lawyer. I want you to be this. Yeah, it's all good and great. But the fact is, you got to look at the child's ability. Yeah. Do they have the ability to aspire to that level? Can they do that? Why don't you look at the ability? Yeah, look at the talent that God has invested in them. Yeah. Rather than push them to be doctor. And some of them, it's like, oh, I wanted to be a doctor. I never became a doctor, so I want my son to be a doctor. Come on, what's that? What's all this about?
Exactly. It's true.
Yeah. And then and the child will carry such a huge load. Every day they'll be thinking, oh, my mom wants me to be that. My dad wants me to be this. The whole family are looking up to me to be a pilot. Whole family are looking up to me for me to be a whole ambassador for the whole village or something. It's just crazy.
That's a lot.
Yeah, yes, so much pressure. We gotta have to really be careful here, people. Yes, too much pressure on the kids. As I said, I don't foster laziness. Yes. We're not talking about laziness here, but we're talking about people's talent. Nurturing talent doesn't mean you put excessive pressure on them. No, that's totally wrong. Yeah. Look at their own ability and let them work to their own potential. And that's what they can. And potential doesn't mean that they all have to be A stars. No. Not everybody is an A star. And we gotta have to accept reality here. Some are very good at playing football. Some are very good at chemistry. Some are good at maths. Some are good at this, agriculture. Interestingly, my dad wanted me to become an agriculturist because he's an agriculturist. I mean, how does that work out? And I had no interest at all in that.
That's right. That's right.
Yeah. So these are the sort of things which put pressure on young people's minds, and then inadvertently, rather invariably affects their mental well-being. And some have developed severe forms of depression. Yeah. And as I said, unfortunately, I've come across 3 deaths out of these situations. And that's why I want to raise this for us all to be very careful here. The other thing is that I've seen people, I mean, we got this thing, what I call immigrant mentality. Yeah. And sorry, it's not negative here, but I thought I need to spell this out clearly. We are here and we're still building mansions in wherever we come from. We're building estates. We're building huge artifacts outside our country of living. This is where we are. And as a result of that, people are working 2, 3, 4 jobs, not even sleeping. And people are just dropping dead like anything else. People are becoming overly stressed, stress leading to distress leading to depression. And I've seen so many people suffering from these sort of things. And my people, I'm just pleading with you all. You can tell the passion I have here. I'm just pleading. We're going to have to look at reality here. We can't live in 2 places at the same time. No. And I've seen, I mean, just last month, one man just passed away. He had built a mansion in Ghana. And come and see where he lives. Here, it's not even a good place. He lives in an old, dilapidated council house. Meanwhile, he's working 3 jobs. We're not saying working hard is not good, but he's neglecting his family. He's neglecting the children, neglecting the wife, neglecting the essential things in life in an attempt to build a mansion in Ghana. And as a result, has put so much pressure on the family here. And some of the kids have developed symptoms of depression because the man is just lashing out to the kids. So we're going to have to be very careful here, my people. Yeah, and I thought I need to make this clear for all of us to try and learn something from it. Yeah, and life is good when we're managing things well. But when these things are coming through, we're going to be, please, my people. Yeah, let's take this very carefully here. It's affecting families, it's affecting lives, it's affecting young people's life. Their education is at risk, their mental well-being is at risk, everything is at risk.
Well said.
Okay,
well
so
said,
I thought I need to make it clear here. All right.
Yeah, thank you. Is it okay to go through some of the comments over here? So we've got Kofi saying that William is spot on, case ability and career path, very important. Yes, so certainly. And then Madam Tina is saying that I agree with William. Parents are busy building homes that they never get to live in. Yes, that is true, because I mean, like William is saying, if you should pass away, I think my internet is gone.
We can hear you.
Oh, hello, can you hear me?
Yeah, we can hear
sorry.
you.
Yes, loud and clear.
So just like Madam Tina is saying, yes, we are building houses that will end up never living in them. And like William is saying, you've got like a 2-bedroom council flat over here, and then you're living on benefits, and you've got this big mansion somewhere in Ghana. What's the point, really? All because you want people to give you a name. You want a name for yourself, that this man he's in the UK, he's got this big house, but then people don't actually know the kind of life you are living over here. Mr. Paul is saying that, thank you, William. Sometimes we put so much pressure on ourselves, and I think that is true, unnecessary pressures. Abdul is saying that this is a very good awareness you just raised. Yes, thank you, Abdul. And then Abdul again had a question over here, which we haven't looked at yet. He's saying that in treating depression, how do you get yourself not to be depressed? And if a social worker is depressed, how do they go about it, especially when the social worker is in self-denial? William, you are laughing, so it's over to you.
No, I thought you were going to give this one to Dr. Ajile on that.
No, you are
all right, okay. It's an interesting one when people are in a situation of denial, which is a tricky thing. I mean, I've come across people who have been diagnosed with even schizophrenia, and they tell you, well, is the doctor that is saying I've got schizophrenia? I don't have that. Well, it's the doctor, so go to the doctor. Yeah, but in all seriousness, yes, where we are showing symptoms which are not of our usual self, then I'm afraid we need to accept reality here. As I said earlier, we all got our personality traits. Some are very outgoing, some are very introvert, some are bubbly, vivacious, whatever you want to describe it. But when people's mood are so low over 2 weeks, and there's still no showing any signs of recovery, where you've lost interest in your career as a social worker, you don't wake up, you wake up and you don't look up to anything. You don't feel like even going to work. You are so stressed. Your caseload is all over the place. You are mismanaging that. You are putting people's life at risk over there because you're not doing a proper assessment. You're not doing proper risk assessment of people's needs. Then you are putting, number one, people's life at risk, and you're also putting your career at risk. So it's important that you accept reality that you may also not be right. Yeah, your situation may not be right. Your situation, yes, it could be that you may be suffering from a form of mental disorder, in a form of depression here. So accept reality, don't be in denial, and then seek for support. That's what I would say to all of us. Yes, and as I said here earlier, regardless of your position, regardless of your status in society, yet nobody is nobody's immune. Yeah, if you can put it that way, it can affect everybody. Depression can affect anybody at all. So regardless of the fact that you are professional, does not exclude you. Yeah, it doesn't preclude you from you having a mental disorder. We are susceptible one way or the other. And even the pressure of work. I mean, look at the amount of caseloads that social workers carry on a daily basis. That alone in itself is enough to cause you some form of a depression here. Yeah, people are really, really struggling. And the worst thing is that if you don't have a good manager like myself, then you are in extra trouble. Yeah, you become, it's a double trouble for you, because number one, you got huge caseload, and then number two, you haven't got good management around you. So that puts you in a more predicament. So please accept reality and then seek for support. That's what I would say in short.
Wow, thank you, William. And I would go on to the next question. Mr. Paul Barton is asking that we now know that rapidly losing weight could be a sign of depression. What about rapidly gaining weight? Has gaining weight got anything to do with depression? Doctor, would come to you.
Okay, yes. Thank you. Yeah, that's a very good question. That's true. Depression can lead to weight loss, as I've described earlier, when people lose appetite and they stop eating. And then, of course, that can lead to weight loss over a period of time. Or if they have delusion whereby they believe that they have no intestine to feed themselves in, so what's the point of eating? And when people have suicidal ideas and they feel that continuing eating means that they're trying to sustain life, whereas their cognition is that they want to die, then they stop eating so that they can actually precipitate their own death. So they lose weight over time. Now, on the other hand, people can also, when they are depressed and they're isolated and withdrawn from the society, overcompensate with excessive eating. Binge eating disorder can develop from there. Do you understand? So, yes, in that case, they develop, obesity as a result of that. So it's not uncommon for people, to present with depression. Just like I said earlier, that depression can manifest in form of insomnia, whereby people, don't sleep well, and at the other hand, somnolence, whereby they just sleep all the time. Like William Haile said, that some people just don't want to get out of bed. They sleep excessive amount of that because they lack energy. They have no concentration, and they just want to shut themselves up, draw the curtain, and then just continue to sleep. It can happen also with appetite. So, and when you talk about appetite, sleep, and sexual activity, they're all biological symptoms. So any of those ones can be affected in different ways, either excessive amount of it or except sexual dysfunction. Obviously, people just go off it. But with appetite and sleep, they can either sleep too much or sleep less, or they can either eat too much, just like they will use alcohol, or not eat at all just to cause their own death. Now, I saw that we missed a question, I think that was asked by Owusu earlier on about the treatment of depression. I'm sure, we're going into that very soon. I don't know whether you want me to start talking about that or there are other
Yes,
things.
please. Let's go into it.
Yes, depression is a treatable condition. It is curative, I would say so. Of all the mental health disorders that we know and we have, depression is one that can be cured. So people can have depression and get cured completely from it and never experience depression again. You realize that earlier on, I talked about postnatal depression. Of course, it's linked to pregnancy. If you stop having children, so you're not likely to have, the postnatal depression. So you can be cured of that. If your depression is linked with, let's say, a reaction to stress or losses and things like you have diagnosed with reactive depression or prolonged depressive reaction. And if the stress is not there and things become positive for you, you may have taken antidepressant before, and then life becomes positive and things are looking up, you may not have depression. But I have to say that once you've been diagnosed with depression, you have a high risk of recurrence in the future. So oftentimes, the risk factor, is previous experience or diagnosis of depression or family history of depression. But it is important to say that people can get cured of depression such that they will not need treatment for it for their lifetime. Now, what are the treatments of depression? Now, depression can be treated in so many ways. Sometimes we can call it a staged or phased, treatment plan. And unless you go to see a specialist, a doctor, not the spiritualist, okay, they will have more to your problem. They will have.
Sorry, I didn't mean to.
Yes, and not the herbalist or the occultist. They will add more to your problem. You will need to see a medical practitioner. And the reason I said that is because of what we now understand as the cause of depression. There's been a lot of research and science, done about the cause of depression. And it has to do with neurochemical, imbalance in the brain, serotonin, imbalance in the brain. Okay. Yeah. So that serotonin is a brain transmitter that helps us to, transmit information, helps brain functioning, helps with execution, memory, and so many things, And in depression, it's been found that there is reduction in the availability of that particular, substance, transmitter chemicals in the brain cells. So the treatment of depression is geared towards increasing that serotonin within the brain cells so that people can recover. So you can see that no amount of concussion, no amount of deliverance, will help. I have to say that they have their own role. But yes, they do have their own role, because sometimes you can even use, placebo, for people. And usually when depression is mild, GP can tell you to just go and take some, vitamin C. And because you believe your GP, your depression will be cured. It's just a placebo. Or they can say, watch and wait. So, but that is for mild depression. But when depression becomes, severe to the point that it's moderate to severe end of things, you will need treatment. If you do not treat it, it may kill you. Okay, it may kill you. So mild depression, you can get away with it with change of sleep pattern, change of lifestyle, good exercise, good support from family, watch and wait, vitamin and all those things, or going for prayers, going for laying of hands and all those things. You might be able to get away with it and give a testimony. But if it is mild to moderate depression, it will need treatment. And usually the GP will not sit on it. The general practitioner should not really, sit on a patient who has severe depression that has not responded to watch and wait or maybe initial treatment with antidepressant. They need to refer them to psychiatrists. And what do we do for them? We will make a general assessment, a thorough assessment of their condition and offer a diagnosis. Once we offer a diagnosis, we explain to them that they have this depression and this is the level and the severity of it. Then we need to find the right antidepressant to help them. What antidepressant does is they help to reorganize the imbalance of serotonin in the brain in several ways. I can't go into specific details, but different antidepressant works in different ways. And there are different classes of antidepressants. And the psychiatrists have enough knowledge to choose which one is right for you. Now, not all antidepressants, work the same way. You may take one, or somebody may take the other one and work for them, but you may take the same one and it won't work for you. So it's not helpful to say, oh, my friend had depression, she took this one, she got well, therefore I need that one, and then you insist that unless you are given that one, you're not going to, leave the doctor. No, you may have it may work for you as well, but it may well be that it's not compatible with you. Some people have been known to start medication for depression and they develop serious side effects, and we have to stop them and then look at alternatives. So you can see that there's a lot of expertise, clinical expertise and experience that goes to choosing the right antidepressant that will help patient. And each of these medications called antidepressants have different properties, So in choosing which one is right for you is based on the careful and clinical evaluation of the type of depression the individual has got. What I'm going to give to a patient with postnatal depression is not what I will give to a patient with post-stroke depression, because some medications have been known through research to have work more specifically for some type of depression type than the other. For example, in postnatal depression, because of breastfeeding may involve, there are some antidepressants that you don't want to give because it may affect the child as well. So you will be restricted. That's why you need specialized prescribing. For stroke, for example, there are some antidepressants, and you have to look into other medications that this patient is taking also, because I have to say that sometimes a lot of patients have pre-existing medical condition and they're on several other medications, such that when you introduce an antidepressant to it, it might cause those medications to fail. For example, if you are taking blood thinning medication, warfarin, because you're bleeding too much, or you have embolism and your blood is clotting, or you are on let's say you've had heart attack, you've been prescribed some medication. If you give some antidepressant, it may make those medications fail. Do you understand? Because of the way they interact with each other. So there is a lot of knowledge, there's a lot of clinical expertise that goes into that prescription. So that's often why the GP don't sit on it. Okay, so they when they realize a moderate to severe one, they always have to refer to the specialist to look at what actually is helpful for that patient, particularly if patients are taking several other medications combined. So don't self-medicate depression. Don't just go to the chemist, and say, oh, my mother used to take this medication and help, let me just buy it, without thinking about what circumstances, what things, are involved. And many times it's not often that you need antidepressant. It may just be that the depression is caused by an underlying medical condition, and the GP may not be able to pick it up, like thyroid. People may don't know that they've got a low thyroid function, and it's only when they come to specialists like us, and when we do assessment, we do blood tests, we find that the depression is caused by hypothyroidism. It's caused by Addison's disease, Cushing's disease. And so what they need in that context is not actually antidepressant, it's treatment for the thyroid, it's treatment for the adrenal problem, okay, it's treatment for the parathyroid problem. So you can see that, when a doctor is sitting and making a prescription or a recommendation for treatment, there's a lot of things that put into consideration, and therefore it is a specialist field. And you need to see a psychiatrist, and help you direct you to the right place. Now, antidepressants are quite helpful. They are safe medication. That is also the issue that people face, and that's often the reason why, people don't want to present themselves for treatment, because they believe, they have this misconception that some of this medication for mental health problem are addictive medication. Okay, they feel that, they're not useful for them. It's stigmatizing to know that they're taking this medication, but really it is not true. You see, because if you are depressed and you leave it untreated, it will get worse. It can kill you. If it doesn't kill you, it might take away a lot of things from you. I know someone at the moment whose job is on the line, because she's not been able to perform her role at work because of depression. And that has been going on for a long time. She's been living in denial. And obviously, she may not kill herself, but she's almost losing her livelihood. She's almost losing her family. She's losing her mortgage. She's losing her investment. And that, we know the consequences of that. So if she should lose all those things, that itself complicates her situation. And how is she going to get out of depression? Okay? Because even if you treat the depression, she will be left with this, complications, social and economic consequences and complication of it. So what I'm trying to say is this. You see, medication for depression are not addictive medication. If you need to stop it, with careful consideration by your doctor, they can help you to stop it, okay? If you develop a problem with one medication that we prescribe for you, we can change to another one. Now, the commonest type of medication in terms of group that we do prescribe are usually called SSRI, selective serotonin reuptake inhibitors. There are different medications in that group. One of them is fluoxetine, Prozac, paroxetine, sertraline, citalopram. So the doctor or psychiatrist looking after you can choose from any of those ones, depending on a lot of other factors I've talked about based on the assessment and what the nature of depression is. And if that doesn't help you, they can move on to the second line or second type generation antidepressant, which are often selective noradrenergic reuptake inhibitors, okay, which is commonly, venlafaxine medication, duloxetine medication, okay? And if that doesn't work for you, there is another type, which is called noradrenergic selective selective serotonin inhibitors, which also have its own specific properties in helping people to sleep better. If people have insomnia associated with depression, they are often very helpful. Now, in some cases, patient may not get better just on a single agent, just one tablet. They may need a combination, of two different antidepressants to help them. That needs to be carefully reviewed because patients who are on two types of antidepressant can develop complications such as serotonin syndrome. So you need a specialist to do that. So don't just begin to combine some medications that you just see in people's drawer or your parents' medication, your spouse's medication, and use it because it may develop serious complications that could be life-threatening. So in some situations, as I said, you need more than one tablet. And in some situations, you may need a combination of, a mood stabilizer to augment, an antidepressant to help it to be more effective for you. Now, all this is gearing towards increasing the availability of serotonin in the brain, within the, brain cells. And many times, according to NICE guidelines, depression should not be treated in isolation based on the pharmacology and the medical model alone. There is a role for psychology. There is a role for psychotherapy. And we have said it many times here that oftentimes people who develop depression often have some adverse life experiences of trauma or some psychodynamic issues in their lives, in their childhood, in their upbringing, in the ways life has dealt with them, personality, and so many things that needs attention of the psychiatrist or the psychotherapist. A psychiatrist can also function as a psychotherapist if they are specially trained for it. But many times, the psychiatrist would need to refer you to the psychological services, okay, which is available within the primary care in the United Kingdom or the secondary care. In Africa, there are psychologists. We've had clinical psychologists on this forum before who also will have expertise in helping to manage people with depression. And they use different approaches and different interventions to help people, with depression. And simply looking at the negative cognitive thinking, cognitive style, the cognitive distortion, the ways of thinking, how it affects our behaviors and emotions. You're also using cognitive behavioral therapy and using either cognitive analytical therapy, using psychodynamic therapy, brief dynamic therapy. So they will be the one to make an assessment of the therapeutic approach that you will need. So you can see that it's not just easy. So it needs a lot of expertise, and people have been trained over many years to be able to help you, adjust to this depression. And as I said, when you have a combination of all this together, you can get cured of depression. Now, the mistake a lot of our patients make, and I think this is very important, is that once they feel well and they feel better, they stop their treatment. And then they feel that they don't need medication again. And then a few years down the line, a few months down the line, they relapse again. And that relapse can be complicated to the point that people may need hospital admission. And this is where I have to say this. People who have depression, particularly severe depression or severe depression with psychosis, often will need admission in hospital. And many a times when it's that bad, they have lost insight, they have no capacity. Then me and William will go in and section them under the Mental Health Act okay, and take them into hospital and treat them. Many times they would need to stay in hospital for a very long period of time. People have been known to have serious depression, severe depression that will need up to 6 months or a year to be treated in hospital, because of the complexity of it. That can be prevented, that can be avoided if the treatment had been provided, more quickly and, at the initial stage before it gets worse. So people have been known to end up in a psychiatric hospital because of depression. And of course, many times when they present with suicidality, in those situations, they are unsafe to be returned home. And oftentimes they will need to be admitted from wherever they're taken to treat their suicidal behavior. Maybe they self-harm or they try to hang themselves, they will be taken straight into hospital. As we said earlier, for postnatal depression, they will be admitted to mother and baby unit, facility to treat them. And for other types of depression, they will go into just, mainstream psychiatric hospital, where they'll be treated. So there is help for depression. It is a treatable condition. People can stay well and enjoy good quality of life. And denial is delay, and delay leads to more complication. And we need to be well aware that, we're not doing ourselves any justice whatsoever if we don't present early for treatment.
Wow, thank you so much, Doctor. That is so detailed, really comprehensive, really informative. The knowledge here is just so useful, so beneficial. So thank you so much. Just as we come to an end, I'd want us to use just 2 minutes to just look at how we can minimize our chances of being, diagnosed with depression. Just 2 minutes. How do we minimize? How do we take care of our mental well-being so we don't get depression? Madam Veronica, what would you want to say about this? How do we not get depression? How do we minimize? Yeah. Oh, I can't hear Madam Veronica.
Volume.
We can't hear you. Yeah. Okay. Should we go to? No, we can't hear Madam Veronica. No. So we would go to William and then Madam Veronica. Hello, Madam Veronica. No, I can't hear you now. So we'll go to William and then Madam Veronica will come on again. William, so can we just give us your thoughts? How do we minimize our chances of, being diagnosed with depression?
Right, okay. Now, as it has been explained, there are various things which can lead to depression. Now, this has been my mantra. Prevention is better than cure, okay? If you can prevent it, try your best and prevent it. But it's not always that you can prevent what can cause depression here. In case, for example, people are faced with trauma, people are faced with abuse at school. I've seen young kids going through these things. So the best thing to do is that where you feel you are experiencing lowness in mood, then your best bet is to try and seek support as early as possible, right? Get support from your GP, talk to people. We in that kind of society where we don't share our things, we've got this kind of thing, I don't want to tell people about my business, I don't want anybody to see what goes on in my family. No, seek support. Sometimes it's good, get talking. I mean, there's this campaign even on TV. Yeah, look at what's happening even in the Buckingham Palace. Yeah. The princesses there, some of them have experienced a form of mental illness, depression, and all that. Yeah, they've come out, they've been outspoken about it. Yes, so it can affect everybody. Get talking, get especially around COVID time, get, if you can video call, yes, try and do that. These sort of things do help. Social interaction, big time, it does help. Yeah, now when the doctor was talking about postnatal depression, now, these things have, in Ghana, for example, it tends not to be common because I remember, for example, when my big sister gave birth earlier, she had her in-laws all around, my mom was around, people were all around. So this sort of thing, social aspect was so great around her. And she never experienced a form of depression. But unlike here where we live in more or less solitary life, it's like me, myself, and I. And we're so busy with life, we don't even care about our health. then these are likely to happen to us more often than not. Okay, and it's important that we pay attention to our health. Important that we pay attention to our well-being rather than chasing money every single day. We chase money, chase money, chase money. Yes, what has money brought to us? I mean, you tell me. Yeah, people have built mansions, people have built, big properties, but they still they haven't got that satisfaction when it comes to having good physical and mental well-being. It's not there. So that tells you that our health is of paramount interest. It's that paramount than even money. Yeah, we need to chase good health. So if you check my profile, it's all about chasing good health. It's hard time we did that. It's important we pay much attention to our good health. So all I'm saying is that, yeah, prevention is better than cure. Get people need to get into exercising. I've started to set up something locally here. Exercise on the park. If you want to join, if you're near Birmingham or Warsaw and you want to join, I do it for free. I've been a fanatic gym member almost to an instructor level for the last 7 years. And I do circuits, proper circuits to try and help people in my community. So if you want to join, yes, these are the sort of thing we need to get into. We need to get into good health. Eat proper food. Don't use money and buy things that may not be even wealthy enough. Yes, may not be proper stuff. Buy good stuff. Buy good food. Eat healthy foods. Yes, this is a sort of investment we need to be making. Not building properties which we're not even going to set our feet in, and then unfortunately pass away. Yeah, so pay attention to our good health, which is so important, physically and mentally as well. And that's what I would say, Elsie.
All right, then. Thank you so much. And I've been seeing William and his press-ups on Facebook, he's doing so well. He's just really, he's an inspiration, really, yeah. We would move on to Madame Veronica. How do we minimize our chances of, being diagnosed with depression, or how do we kind of look at our mental health?
I guess, can you hear me now?
Yes, we can.
Yes.
Yeah.
I guess William has said a lot, but the only thing that I'll add on to it is that even as health professional, we're not immune, and we know exactly how we feel when it's not right up there. And I'm talking to us professional and as much as the public out there. As much as when you know that you're palpitating, your heart is palpitating so much, oh, there's something wrong with my heart. It's the same way when there's something wrong with your head, you will know. If you're not right in yourself, you will know. So as William has said, let's talk. This forum where we've opened this forum so that at least some of us have our faces there that you can contact. If you have anybody who works in healthcare or who works in mental health, contact them and speak. And again, I'm speaking to our African community because we don't talk. We do not talk, please. So let's find anybody. If anything is not right, don't hide. Because when you hide, it's not going to do you any good. There is help out there, as Doctor has explained, from top to bottom. And it's for us to assess it. So please, let's talk about whatever is happening. And when we talk about it, as William has said, if there's something wrong, we can pick it up. And let's look after ourselves. That is number one. That one, we cannot, we can't run away from it. We need to look after this body first. Because if you are well, then you can look after the people around you. If you're not well, you can't look after anybody. Yeah. And again, when we are around our people, let's keep an eye. Especially those of us, and I'm not limiting it to just as the professional. You don't have to be in mental health, or you don't have to be a social worker to see someone in your home or in your community, or a friend or a family friend to know that, oh, there's something wrong with this person. Let's get in there and ask and offer our help and our support as much as we can. Let's get talking, because hiding doesn't help us, and not talking doesn't help us at all. It doesn't help us.
Yeah. Wow. Thank you, Madam Veronica. Let's get talking. Let's prioritize our well-being, physical health, emotional well-being, mental well-being, and let's also be supportive to people who are diagnosed with a condition. So finally, we'll come to Dr. Ejele, please. Well, how do we minimize or prevent being diagnosed with depression?
Yeah, I think it's simple. I mean, everything that's been said so far is what we need to do. They're all classed as mental hygiene practices. Good sleep, invest in your support network, family, If you don't have family, try not to live in isolation.
Yeah.
Make friends, reach out to people, belong to a community. You know, nowadays the world is a global village. So even if you can't physically have contact with people because of this COVID, you know, stay online. You know, don't just shut yourself out of the social media.
Yeah.
I mean, if you shut yourself out of social media, this kind of educational activity program, you will miss out on it. So, but it is a way of participating. People have been commenting. People have been asking their questions. And a lot of people are getting, you know, a lot of useful information. So that is helpful. The other thing is, obviously, you know, when we see the heralding symptoms based on what we've been talking about, don't leave it too late. You know, nip it in the bud. Prevention is better than cure. Rather than leave things being complicated, get the treatment you need. Don't shy away from taking medication, okay? Because it might just save your life. So I think those are the things I would like to say. Doctors are your friends. You know, make friends in the society you live in. You know, don't distance yourself from family. You know, and don't distance yourself from friends. Invest in your social environment and social network and capital. And that will go a long way to get you help, you know, at the time that you need it most. Thank you.
Wow. Thank you so much.
Can I just add a last thing that, like when doctor mentioned that the extreme form of depression, when it's gone to the extreme that you need to be admitted into hospital and be taken care of. I like the way he described every stage of the care that has been given. And again, I would like to encourage our African community as well, that going into mental health hospital is not a bad thing. It's a good thing because when you're there, you learn all those things that he said in terms of the medication that has to be, to find out the best medication for you, to be able to titrate them up, to be able to work with you with your medication. Is safe to do it in the hospital. And then once you are in the hospital and you are being taken care of, obviously the other psychotherapy comes into play as well, because you have a psychologist there who does it and all that whilst you are in hospital. And again, we're working with the family to be able to educate the family as to how to care for you when you get out. So it's a full holistic package that comes with it when you go into the hospital. And if you don't, and you're saying that, oh, if I go to a psychiatric hospital because of the stigma, you're losing out. And even the people around you will not have the understanding of what exactly is happening to you for them to know. But if you're in hospital and you have the meetings and your CPS meetings and you come in, we invite family. Some of them will say that we don't want our family to come in, but it's for your own benefit that when your family member comes in, they know what to look out for. When you're discharged and you go home, they look out for you to take your medication. Make sure that you're taking your medication. Make sure that they're looking after your physical health. They have an understanding of what is happening, and then they can help you based on their understanding that they have. But if they don't have the understanding, they can't help you. And that is when they keep labeling you and calling you names and all that, because they themselves don't understand what is happening to you. So I will encourage that if you start, before you get into hospital, seek the help, because you can have help out there. If it's gone overboard and you have to go into hospital, please go, because we are there to help. The doctors and the nurses and the social workers, psychotherapists, and all those things who are there, we're there to help you get back on your feet. And that is what we're doing. So I will encourage that if somebody has to go into hospital, yes, let them go. But family members have to show interest into their care right from the beginning till discharge. Right from admission till discharge, show interest in it. Go into the meetings, ask questions if you're not sure, because when they're discharged and they come home, you have to look after them. But then if everybody has got an understanding of what they're doing, it makes it easier.
Okay.
Wow.
Please, can I just clarify something? Just 1 minute, please. I know we talked about, you know, a lot of things, but honestly, I'm not trying to sort of underestimate the role of spiritual treatment.
No.
What I'm trying to say again is that don't rely solely on that, and don't
Yes.
expose yourself to exploitative spiritual activity. You know, yes, there's role for prayers. You know, there's role, particularly if it is in tune with your cultural or spiritual belief. Also, reach out for spiritual help. It can also help you in managing depression or recovering from depression, or making adjustments to the difficulty you have that led to the depression in the first place. So I'm not underestimating the important role of spiritual therapy. It is helpful. Other things I've not mentioned that I think just came to my mind is the use of electroconvulsive therapy, ECT,
yes.
or repetitive transcranial magnetic stimulation. These are all advanced treatments, perhaps available in the Western world for severe depression, and we do have facilities like that, and there are categories of patients that will need that kind of treatment, in addition with medication, to be able to get them out of depression. I just thought I should mention that also.
Wow, thank you so much. I know we could go on and on and on. This is such an exciting topic, because, we are talking about real life experiences.
Yep.
We are talking about, knowledge, expertise, research and all that, and, all in one. And we've got people here, panel members here with such, so much knowledge. So yeah, we are all enjoying this. And then because of that, we keep going on and on and on. Yeah, so we've just gone overboard a bit in terms of our time, but then this has been really useful. So as we normally do, we always do, we will just, go around again for panel members to give us their final word before we go off the show. So we'll start with William, please.
All right. It's been so great. And I like the way people have contributed to the show today. I've been looking at the messages that have come through. So I just want to say a big thank you to all the people who are watching and contributing. Yes, we are in it together. We are sharing our experiences. We are helping each other. That's what life is about. Life is great when we are all winning. That's what it is about. Yeah, it's not just me winning, Dr. Ajileye winning, Madame Veronica winning, and of course Elsie winning. No, it's great when we're winning together in a collective way. So on this note, I just want to say a big thank you to everyone out there. Let's do our best to look out for each other, support each other as much as we can. If somebody tells you of their private information about their private, let's say, mental ill health, please do your best not to broadcast it. Yeah, that's not what we're talking about here. It's difficult for people to come out and share their stories, most especially their mental health issues. So when people come to you, please don't spread it out there. No, they come to you in confidence. Support them as much as you can and direct them to the services out there, and obviously support them in a better way. So yes, that's what I would say to our viewers and our listeners. God bless you all, and thank you.
Thank you, William. We'll move on to Dr. Ajele. Your final word to our viewers.
Thank you. I won't say much more than you can see how passionate and how serious we are on this platform. And I want to thank Elsie for putting together this opportunity to be able to educate our people and help them. We see to your mental health. So please, let's see also to our own mental health in our individual places. Thank you.
Yes.
Thank you, Dr. Ajele. We'll move on to Madame Veronica.
Wow, it's been awesome. Thank you all as well, and thanks to our listeners. And the questions that came out were quite great. All I want to say is that depression is real. It can affect any of us. It can affect the young, the old. So yes, let's look after our mental health, like Doctor said. We look after our physical health. Let's look after our mental health as well, and let's talk. And when we are spoken to, let's keep confidentiality, like William said. Don't talk about it everywhere, because that is why people don't talk, because they feel that their business will be out there. But with the mindset that we have to help, let's keep confidentiality. And I will say that as we're here, people have seen our faces, and the LC people can contact us through you. If anybody wants to talk to us on a one-on-one, I am available to talk in anything. So please, if anybody wants to talk, we can do, because that is what we're here for. Thank you very much, and good night, and God bless.
Wow, thank you so much. Yes, so do get in touch with us if you have questions, or you need any support, or you need any guidance. By all means, please do get in touch with us. So on a final note, thank you so much, our panel members. You are, as always, you are great, you are fantastic, and the passion you have for what you do, it's just amazing. So thank you, and God bless you. And to our viewers again, thank you for participating. Let us go out there and keep educating, keep creating awareness, and keep empowering people. So once again, thank you, and God bless.
Bye bye.